From that, one more thing that we do want you to know is how to elongate the body to take the pressures off those herniations and bulges that people talk about. The core shortens, the connective tissue shrink wraps it, and now you're stuck. A very mild traction, expand the connective tissue, then recalibrate the primary flexor, which we've shown you is how you turn off the back because it turns off all the neurology to the lower lumbar. Do those two positions and get up, and a large percentage of people have bypassed back surgery doing this simple procedure. I want to share it with you. The secret is know how to cook. Do not get on your feet once you've done the first part until you've done the second part. It is a cooking formula. The first piece expands the connective tissue. The second piece recalibrates the primary flexor of the muscle. When they come back online, they match their expansion. When your feet turn in, your body calibrates your bias, and you are taller. And the gristle has less pressure on those nerves. And they quit saying, "Can you hear me now?" So, when in doubt, if it really hurts, always turn your back off first. Fetal position is your godsend. When you can tolerate it, do it this way. If there's a sway in your back, it will not work. It must be a nice clean line as though you're laying on a plank. Gravity does the work. Talk to Jesus. Works for everyone. You'll come put your knees here and lay over this, please. We built up the array of bolstered materials that we use in our kit. It should feel like you're sliding, and every so often you will have to readjust yourself to gravity, kind of like a day at the levee. You ever fly a kite on the side of the levee and you're laying on the levee, but by the end of the day you slid down that thing. It's amazing how you just creep right down. So you want a complete line all the way down, about 30 degrees for most people. How do we know if we have the right amount of slough or the slump for the connective tissue? Well, the test is every 5 minutes you reach your leg to a bent position and you rock it back and forth about a half a dozen times, and you let it fall back down. And if you've done both legs, at that point the weight of the movement will have made you elongate and slide down. I call it shaking out the bones. An old man taught me this. He used to go between assisted living and a Walmart and fall down the ditch and knock his hip out of place. Mid-80s, poor thing, nobody could work with him. He was so frail. I said, "Lord, let me help this man." And I got to thinking like an 8-inch tractor, and it just needed to be split just a little bit to break the gears loose. Well, you take this, you let the gristle expand. The gravity, it doesn't fight and guard. And you rock him back and forth, and he goes ka-clunk like the old 8-inch tractor, and he was good again. But I learned you don't get on your feet from here, because once you've loosened up the gristle, the connective tissue that's housing that muscle, you've taken away its shell. And if you step on your feet, it's going to go dog food and tighten up. So, keep away from the guarding mechanism. You lay like this approximately half hour. Every 5 minutes you rock your legs back and forth. From here you crawl onto your back. Do not get on your feet. Get your legs in the fetal position to reset your back. Turn your feet in to stand up. And this is the information that you already know from previous videos.